Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm starting a new series on thrombophilia, deep vein thrombophlebitis, and pulmonary embolism. These are three extremely common conditions that are causing a tremendous amount of health problems throughout the world and death as a result of them as well throughout the world. One of the most common conditions that cause people to die and the cause of death can only be discovered after autopsy happen to be pulmonary embolism. A lot of people die of pulmonary embolism, hundreds of thousands, and nobody knows anything about it. Some of them had no symptom, and yet at autopsy, if autopsy is done, and oftentimes autopsy is not done, so autopsy is done, turns out that they had pulmonary embolism and they know nothing about it. Within the last several years, I've had several patients who I admitted to the hospital because they had deep vein thrombophlebitis, and I felt that because of the age and their home situation, and I needed to treat them more appropriately inside a hospital. And because of that, I did my evaluation, did the usual history and physical, and admitted the patient. But to be cautious, I decided, in addition to doing an ultrasound of the legs to prove that the clot exists, I decided out of the blue, for no reason, patient has no symptom whatsoever, based on knowledge, experience, and I decided judgment to do pulmonary CT angio, which is a test that will show you there's a clot in the lung. Years ago, we used to do, lung scan. They're still doing lung scan all over the world because not everybody or every place have access to CT angio. Several times, patients end up having clots in the lung, both sides of the lung, with absolutely, completely, totally no symptoms. Can you imagine that? And the treatment is completely, totally different if somebody has a clot in the leg as opposed to if they have clots in the lung. The duration for a clot in the lung is 6 months. The duration for clots in the leg is 3 months, 12 weeks. Unless, of course, the patient have what I call thrombophilia, which I will explain you what that is. Then, of course, once they're clotted, not only that you have to treat the clot, but they must remain anticoagulated for the rest of their lives. How about that? This huge book that I wrote that came out this year, African American Women's Health, chapters 74, 75, and 76 deal with this particular subject. Chapter 74 deal with thrombophilia. Chapter 75 deal with deep vein thrombophlebitis. And chapter 76 deals with pulmonary embolism. Every single thing that you ever wanted to know about these three conditions are listed in those three chapters. How you can get your hand on this book, I have no idea, because I'm not in the business of selling books. And of course, for a reason that should be obvious to you, people are not very anxious to sell my book online, because why should they promote the book that a person of color has written? It sounds crazy, it sounds sick, but that's what is in fact going on. I have gone out of my way to go through the process, going to the computer, which is something I'm not good at, to do all the right thing, fill out all the right papers, get the book on all these fancy places. I'm yet to get $1 out of it. I have one particular publishing company, which is always our universe, I don't mind mentioning it, always send me a few dollars, which I put on an account, and I usually write a check to give to charity. Everybody else, forget about it. Not a single time. I have written, I believe, 5 books with an outfit called Lulu. I'm still wouldn't get $1. 5 books over the last several years, I think I have put on. This is not bad mouthing. This is statement of objective fact. Done all the right thing. I'm still waiting to get $1. And then when the promotion Oh, they're going to sell the book all over the world. They're going to do this. They're going to do that. Not one. I'm yet to get $1 from Lulu, even though I have written, published about, I believe, all the total of 5 books with Lulu. Okay, I have an account. I know how to open the account. It has been zero for the last 4, 5, 6 years or so. You can't make this up. This is a very good outfit. Nothing wrong with them. They're just simply not going to sell book for me. Why should they? In their mind, they shouldn't. So even though I'm a client, I do follow the right step. I pay my money. I did everything I'm supposed to do. Follow the promotion, sign the right papers. I'm still with. You can't tell me that you're going to distribute books throughout the world. And those books are very fascinating, interesting books. Not one time you haven't sold one copy. Give me a break. Okay. You understand that? So don't think that I write this book. I'm an academic doctor. I write books to make academic contributions, etc., not to make money. I practice medicine to make money, okay? Because they were not going to sell for me, no matter what the promotion. They're just not going to do it, okay? Simple as that, okay? So how you get your hands on this book, I have no idea. That's up to you to decide. The books are out there, okay? In any event, getting back to the subject at hand, don't think just because somebody don't have all the classic symptoms of a particular condition that they may in fact don't have that condition, okay? All right? I just finished telling you, several patients this year admitted to the hospital for clots in the leg, evaluated them properly, take the history, take the physical, did the EKG, did the chest x-ray. But something severe, I think you should also look for the possibility of a silent clot in the lung. No symptom. I mean, cardiopulmonary symptom is people have fast heart rate, shortness of breath, chest pain. That's a fever. Fever, fast heart rate, chest pain, shortness of breath is a classic sign of clots in the lung. None. Zero. Nothing at all. A whole lot of other problems. None of these. And yet, several patients of mine admitted to the hospital right up the street at Davis Avenue had clot in both lungs. And as I just mentioned before, the management is different. If you have a clot in your legs, the treatment is 12 weeks, provided so long as you don't have a thrombophilia, and I'll explain to you what thrombophilia is in a minute. But if you have a thrombophilia, the clot is treated and you must be remain on anticoagulation for life. That's different. But a lot of folks who have clots in the leg, we can't find out the source of it. So therefore they wind up being treated for 12 weeks, and the doctor, he or she, has to make a judgment whether they should be kept on lifelong treatment or not. I'll dare say to you, however, there's no such thing as not being able to find why the patient clotted. If you know how to evaluate it, believe me, you'll discover the thrombophilia because it is there. Everybody who clotted, whether they were lying in bed in the hospital or they had an accident, whatever, there is something else that caused them to clot. Here comes the subject matter. We're talking about thrombophilia. I don't have my pointer with me. I'll try the best I can to point. This is the list of things that can cause somebody to clot. These are all, each individual one represents a thrombophilia. Let's talk about Trousseau's syndrome. Dr. Trousseau was a French surgeon who lived in the 1800s. And he made the interesting discovery that patient that he was taking care of developed clots when they had cancer of the pancreas. So that was a major discovery. It was a fantastic article about it, and it was a major worldwide discovery in the 1800s. It turns out, unfortunately, that Dr. Trousseau himself died subsequently from the same syndrome that he described, but not from cancer of the pancreas. That's where there's a confusion. Dr. Trousseau died of cancer of the stomach, secondary to a clot, which is part of the Trousseau syndrome. What is the Trousseau syndrome? The Trousseau syndrome is that when you have it, first of all, you have to remember something. And let me to clarify something. I have gotten myself into a lot of trouble at the hospital up the street in White Plain because somebody who was in charge of the Department of Medicine made a statement that I did something wrong because I said that somebody had Trousseau syndrome from prostate cancer. I was not wrong. In fact, one of the most common cause of death post-surgery from prostate cancer is Trousseau syndrome. You could have prostate surgery on Monday and die on Tuesday. While 2 days later, because you develop a clot just like that, you die. That's a very well-known syndrome to occur. You can have cancer of your big toenail, which can happen because of melanoma, and the first sign of it will be a clot. Any cancer, no matter what it is, can cause you first to clot. So whenever someone clot, and you're going to evaluate the clot, you documented the clot, you must also, while you're evaluating it, think also of an occult malignancy somewhere that can cause them to clot. That's Trousseau syndrome. Okay, so to say that I was wrong by saying that someone had cancer of the prostate and they develop a clot, they have Trousseau disease, is because the person doesn't know what he was talking about. And this guy went out of his way in an open forum, in an auditorium, and he was going to go after me because I didn't know what I was talking about. And he did. Subsequently, he managed to get himself to become chief of medicine at the hospital of the street for one purpose only, to try to find something he could do to me. Here it is. I'm a professor of clinical medicine, 2 such professorships at 2 prestigious medical schools. This man went out of his way when he couldn't get me for being, after years of being chief of medicine, he decided to become chief of something called peer review committee. You can't make this up. One after me again, accusing me of doing something that is completely insane. I had nothing to do with it. When he got caught, then they were forced to send me a letter of apology. You can't make this up. This is insanity, stupidity. I have to waste my time when the leading physician in the country in the 21st century in the world. I have to waste my time. And he tried. The administration allowed him to do it. I had to defend myself. But when they get caught, then they run all over the place. Oh, I'm sorry, blah, 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 blah. Here's a letter of apology. Can you imagine this, okay? You can't believe these things are happening in a city of White Plain in 2018, 2019, in the 21st century. This is what I had to deal with for absolutely, completely no other reason because of the fact that I'm a Negro person. That's it. And God gave me brain power, and I'm smarter than they are. You can't make this up. I have to waste my time. How can you be reviewing me as my peer? You're not at my category. You're not a professor. You're not an M.A.C.P. You're not a writer. You're not a journalist. How did you get to be my peer? Just because you have an ND degree and I have one doesn't mean you are at my level. You couldn't win a case in court against me. You couldn't win a case in against OPMC against me because you're not at my level. Unless I commit an objective crime, then that's different. Of course, I break the law. I haven't done any such thing. You're wasting your time. And I have to take my energy, been very busy taking care of patients by myself, wasting my time dealing with all this nonsense, okay? You can't make this up. They did this to a doctor in California. If I may tell you about the case, I don't know, I'm not a lawyer. A few years ago, for political reason, they drove this doctor out of his mind, literally, destroyed his career because of some peer review nonsense. He sued them because he was a competition to that particular hospital. Oh, they said a lawsuit would not stand because these people are immune. Well, the California Supreme Court said there is no such thing. The lawsuit stayed. The lawsuit stood to the point now there is everybody can sue anybody, and a board of directors peer review across the country because of this lawsuit if you do something wrong to them, okay? To that person. It turns out that the hospital had to pay so many $1 million. I think they filed for bankruptcy in California. I'm almost sure they did. Okay, they try to destroy this doctor the same way they tried to destroy me. Okay, and the California Supreme Court said yes, you could be sued. So now you know there's precedence. If you're going to sit on a peer review committee, you better make sure you have a whole lot of money as insurance to protect you. Millions. If you're going to sit on the board of directors of the hospital, you better make sure you have a whole lot of insurance to cover you for money because you're going to get sued one of these days, okay? In any event, let's get back to the business of at hand, which is thrombophilia. So I talk about Trousseau syndrome. What's going on in Trousseau syndrome? It is the cancer cells themselves that are constantly releasing a series of procoagulation factors, procoagulant factors, we call them, constantly. And those coagulant factors are causing clot to develop. That's what. So if you have cancer syndrome, you have cancer, you develop Trousseau's disease, Trousseau syndrome. The best way to treat it, in addition to providing anticoagulation for the patient, is to treat the cancer. Because as long as the cancer is there, there's nothing you could do about to prevent the clot other than it's going to keep happening. Because of that, there's certain medications such as Coumadin that cannot be used. You have to use heparin or Lovenox or something like that. So that's Trousseau syndrome, which happens all the time, unfortunately. So when somebody has a clot, you are required, in addition to whatever else can cause the clot, you must put in the back of your mind there's some simple things you could do to make sure this patient, he or she doesn't have an occult malignancy somewhere. You can't just say, well, here's a clot, here's some anticoagulant and take it, blah, 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 blah. You got to be very careful. So that's the first one on the list. Now you know a lot about Trousseau syndrome. Now you know a lot about that came after me. Some idiot came after me because he heard that I had said that somebody had cancer of the prostate and developed Trousseau's syndrome. And an open forum in the auditorium, he claimed that I didn't know what I was talking about. Trousseau syndrome can only occur because of cancer of the pancreas, which is hogwash. Dr. Trousseau himself died of the same syndrome of cancer of the stomach. Any cancer, no matter where it is located, even in the earlobe, can cause you to have Trousseau syndrome. You understand that? So when I reacted to it, then all of a sudden, I had to be destroyed. Can you imagine? As hard as I work to get where I am, and some fool is going to destroy me because he said something stupid, and because of that, his way to get back to me is total destruction. Can you imagine? How arrogant, how insolent can somebody like that be? And unfortunately, it's happening all the time, not only at this hospital and all over hospitals and in different communities and academia as well. People react to you so they can wipe you out for no reason. Not that you hit them over the head, not that you broke their toe, because they don't like you, they don't like something you say, or you catch them saying something stupid, and they'll go out of their way. For the rest of their life, they're going to try to destroy you. What kind of garbage is that? Okay? And that the person didn't create you. Like I said all the time, if these people created me, there was no way my IQ could be as high as it is. Okay? Let me repeat that. If they created me, they gave birth to me, no way my IQ would be as high as it is because they're not that smart. Okay? They think they are. They're pretending to be, not when I'm around. Okay? So, let's get back then to another condition called homocysteine. Homocysteine is a very interesting story because there are many people who are actually born with issues involving homocysteinemia where they wind up a lot of kidney problems, etc., etc. I'm not going to bore you with that, but suffice it to say, if you have elevated homocysteine, then that's a thrombophilia. If you have decreased antithrombin 3, that's a thrombophilia. You say, well, how did you get from decreasing antithrombin 3 and be able to clot? Well, you got to understand something. Again, I'm going to be here several weeks discussing this with you. Please learn. a ton of the 850,000 practicing physicians in this country don't know this stuff because the people who taught them didn't know this stuff either. And I'm not being arrogant. If you think I'm arrogant, go and take a look at a JAMA that came out several years ago. What that JAMA said was written by three from Stanford University by three Caucasian physicians from the bedside department of Stanford University that said the same thing, that the present-day doctors don't know what the heck they're talking about most of the time because the people who taught them didn't know what they're talking about either. This was written in JAMA. You could check it, okay? I have a copy of the JAMA in my office. This is the truth because this is not stuff you could just learn like that. You got to be in academia. You got to be reading all the time, teaching all the time. These are modern 21st century stuff. That's your problem if you don't know it. What is antithrombin 3? Antithrombin 3 is a substance. It's a substrate to heparin. Heparin will not work. Heparin is anticoagulant, yes, but it won't work if you don't have antithrombin 3 at a proper level in your body. How about that? So antithrombin 3 is a substrate that allow the heparin that we produce through our mast cell. The mast cells in the gut produce heparin. The antithrombin 3 is a substrate that allow the heparin to work to keep our blood thin. You understand that? So therefore then, antithrombin 3, when it is low, the heparin wouldn't work even though you have the heparin in your body. Therefore, you're going to clot. Okay. The next one online is protein. Listen, this is going to take a long time. I'm not in a rush. There's no way I'm going to finish this now or next week. But it's important to go to that. Protein C. If your protein C level is low, you has a predisposition to clotting. You're going to clot. That's right. First of all, let me back off for 1 second. Take my time, okay? I mentioned the word clot. Clot is referred to technically as a thrombus. That's right, it's a thrombus. There are two separate types of thrombus. They look alike, but they're not the same. So learn that, please. Pay close attention. You have thrombus that are white thrombus, you have red thrombus. Yeah, they're both look red, it's a clot. Thrombi that are developed in the low flow system, which is the venous system, are all red thrombus. All thrombi that are developed in the high flow system, the arterial system, they are white thrombus. Okay, you say, Val, what is the difference between the white? Listen, this is highly academic stuff. If you don't want to learn it, that is your problem. But those are the facts. A white thrombus is consisted mostly of white blood cell and platelet. Okay? White blood cell and this is debris. It looks like on the inside of the clot, the debris that are in there are mainly white blood cell and platelet. That's crucial. Which is crucial both in the causation of the thrombus, also in the treatment of the thrombus. If you don't understand that, then you cannot treat the different thrombi properly. And the red thrombus develop in the low flow system known as the venous system. They're all red thrombus. They are contain mostly of the red blood cell and debris. Very, very few platelet. And red blood cell and debris with very few platelet. So red thrombus is not the same as white thrombus. The treatment, as I discussed this over the last several weeks, you will understand, you will remember red thrombus versus white thrombus. Crucial, because the medication to treat a red thrombus is completely different. Thrombus that occur in the venous system treated completely, totally differently, and thrombus that develop in the arterial system are treated completely, totally differently. If you don't understand that, then you can't treat the patient properly. Anybody who tell you they can treat the patient properly, they don't understand what I just told you, they don't know what they're talking about. And the patient will pay the consequential price of poor medical care. You could tell them I say that. Protein S, if it is low, you will also clot. Something, if it is high, like homocysteine, that's abnormal. But protein S, if it's low, that's abnormal. Antithrombin 3, if it's low, that's abnormal. Protein C, if it is low, that's abnormal. Okay? And I'll eventually explain to you all the different conditions in medicine that can be associated with things that are high level, things that are low level. They're all bad. For instance, one of the things that happen when people have HIV/AIDS, they can have kidney problem. Well, because they have kidney disease, they are pouring out in the urine protein S. As a result of that, one of the most common problems that occurs in people with HIV/AIDS is clotting, pulmonary embolism, strokes, because of lack of protein S, because they develop AIDS-associated kidney diseases that cause them to have passing out tremendous amount of protein S in the urine. Therefore, they have low protein S, resulting in the thrombophilia that causes them to clot. The clot can occur in the arterial system. It can occur in the venous system. You understand that? If you think for 1 second that academic medicine is the same as regular community medicine, you got other things coming. It ain't the same thing. It's the difference like day and night. I was telling one of my friends this morning on the floor at the hospital, I suddenly realized something I knew before, but I reinforced it yesterday. One of the most important things that can happen to a human being is to get yourself a good doctor. How about that? Listen, I'm going to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.